So Anne, tell me about the Michael Project.
Well, the Michael Project is a 3-year project working with homeless men in Sydney. We start with our homeless accommodation services, 7 of them that we've been working with, some like Mission Beat on the street, some like the Fairlight Centre, which is an accommodation service. And what we've added to that 7 services is a whole range of new services, things like a barber, a podiatrist, literacy programs, drug and alcohol counsellors. And as well as that, the third component is that we've added a new way of working with clients so that they can access that smorgasbord of services, that, if you like, but access them in a really timely and efficient way, with the caseworker being the key person that brings it all together for the client. So we've recently released the first snapshot, the first data on the baseline data. So that means we've surveyed 253 men when they came into the Michael Project, and we asked them a whole range of questions about their health, where they'd been living, had they been on the streets for how long, those sorts of things. A couple of things have stood out. The first one is that most of these men, 253 of them, have experienced trauma over the course of their life. Many of them have had their first traumatic incidents as early as adolescence, so well before they've become homeless. We also know that this group, 20% of them, 1 in 5, have got post-traumatic stress disorder. That's new information. We were surprised at the level of that trauma. And what the sort of trauma that we're talking about, Paul, is where someone's actually been part of a serious assault themselves, or they've witnessed it, they've been part of a life-threatening incident. So really major events in their life. So you can see that we need to deal with that, and that's not just about dealing with providing someone with a house. We've also found that about 70% of the client group have a diagnosed mental health or drug and alcohol issue, but also the same number of people, about 70%, feel that they don't have a family that is supportive of them. That starts to be really telling in terms of the sorts of responses that our caseworkers can use. Interestingly, another flip side of it is that many of this group has had a more recent attachment to the labour force than we expected. So of those in our short and medium term accommodation, half of them had actually been in full-time employment in the last 2 years. That starts to change our collective understanding about the lives of these men and what might actually be possible.
It might appear that it's a Sydney-centric, has a Sydney-centric focus. The lessons we learned from the Michael Project, will they be applicable nationally?
Paul, we've been working very closely with 2 universities on the research, so Murdoch University in Western Australia and the University of New South Wales in Sydney. And what's good about that is people working in WA see homeless men there, as well as people in Sydney seeing homeless men here. And in talking with the researchers, they've said to us, these are the same men that we see in Perth. These are the same men we see in Brisbane. So we're pretty confident that this profile we've gathered of homeless men, which as you say is a unique one in Australia so far, 253 men at a depth we've never known before, is actually pretty indicative of the homeless male population across Australia.
What next for the Michael Project?
The first step is to get this profile data out and about so that governments across the country, other organisations working in the sector really know this new knowledge that we have, and to also help it inform our practice. So Sean Lappin, our National Homelessness Advisor, is working with staff across the country to help them put this into practice. We're also keen to look at the 12-month data, which will be out in the not-too-distant future. We'll use that also as a basis for advocacy. And we're going to build already on the learnings of the Michael Project to a new initiative called the Misha Project. So we'll take all that we've learnt out of this, but also going forward add a housing component. So again, we'll be trialling a slightly different model, again having the research, and then hopefully informing our own practice, but also policy across the country.